Well, the manufactured decline is underway. Yes, you will see more of this. And this is what happens in public-private partnerships. So the public is the public-private partnership is the federal government colluding with, in this case, hospitals. Does that mean everybody in the hospital knows? No. If I even try to tell them, they think, oh, that's ridiculous. It's too far of a conspiracy. Okay, it just keeps happening everywhere. There's a reason you don't have staff. They don't want you to have staff. They don't, because part of the socialist dream is Medicare for all. So even, let's say this hospital, Mission Hospital, there's only two reasons for this. That this is happening, and you'll see more of it, is one, it's because they're already in the public-private partnership. So this is part of the manufactured destruction of the healthcare system so that it gets so bad, to where the federal government has to come in. That's what the nursing unions want. Because the nursing unions and the nursing profession at American Nurses Association has pushed this socialist bullshit forever. The universal health care, the one-payer system, the Medicare for all. And they do it on the heels that we care about health, and this is what we need to help everybody. They want to help everybody, that they'll go as far as to support open borders that won't help anybody. They'll go as far as to knowing the globalist agenda and aligning with it, which means destroying healthcare to force the Medicare for all system in. So the only other thing this could be is that they're targeting Mission Hospital, but I doubt it, because I think most of the hospitals have been eaten up by the bigger systems, most of them, because most that maybe didn't want to go along with it, they've known about this, because look, long before all of this took place, these hospital mergers, the hospitals were already making deals with each other. They were. A former CFO for a hospital told me that. He told me, he said that, no, there were agreements we had with hospitals in our area, non-competition agreements. So see, that's that. So when everybody wants to carry on and complain that the free system, or the free competitive system doesn't work, it doesn't work when you have hospitals doing that, or any companies. When you're saying, he said they would, back in the day it worked where it was like, okay, we won't compete against you in the lab area department, and you don't compete against us in this department. So what this does is it would serve each hospital in the area, because I've said that with competition, it forces each of those competitors to have the best care, the best staff, all of that. But when they get in bed and start colluding that, yeah, we won't compete with you on this, we'll have a no competition agreement, then what it does is it serves the people at the top. It just does, because then they don't have to provide the best in those areas. Well, that's now just blown up it's no longer just an agreement between a couple of health systems. Now all of the health systems have merged into one big system. So the only way this could be happening, other than what I just said, is if somehow Mission Hospital has not merged with any other hospitals and is managed through all this, and I doubt any hospital has, but managed to somehow stay independent. And in that case, if they've managed to stay independent, then what will happen is they will target them, which would be doing something like this, to where them coming into compliance. Look, there's no hospital that's in compliance. They haven't been, though. They haven't. The mere fact that they're able to cut staffing to the point where it's unsafe for patients and staff is non-compliant. Every hospital in the country should pretty much fall under deficiency there, but they don't. It's only when they choose to. It's only when they choose to go after a hospital. So they're going to want to start doing this. One, because it makes you think then, the public, like, oh, good, they're on top of this. It's the federal government. They're the one, they want Medicare for all. The federal government is all about socialism. Yeah, sadly, our three-letter agencies. I mean, clearly that's obvious by now, isn't it, to most people that have a brain? Should be. So it says here, the federal government has declared that conditions at Mission Hospital create an immediate jeopardy situation The most serious deficiency regulators can assign. The Federal Centers for Medicare and Medicaid Services informed Mission Hospital Chief Executive Officer Chad Patrick about the declaration in a February 1st letter obtained by Citizen Times. Local elected officials, health advocates, retired physicians, and hospital nurses discussed the findings during a February 6th news conference at the government building downtown. According to the letter, Mission is not in compliance with 6 federal requirements for participating in Medicare. If the hospital does not remove the immediate Jeopardy conditions or come into compliance with Medicare requirements by February 24th, the federal government will terminate its Medicare agreement with the hospital. That's bad, because it'll cause the hospital to close. Terminating the agreement would cease. It's bad for the rest of us. For the CEOs of the hospital and all the globalists, oh, this is their dream. Because, like I said, they would love to just chop it all down, but they're trying to do it in this manufactured decline so the public doesn't catch on to it. Because, listen to me, people would say, oh, you're crazy. It's just yeah, okay. Yeah, but you see everything that I've been saying for 3 years taking place. Terminating the agreement would cease reimbursements through the federal insurance program, which would also eliminate Medicaid funding. The hospital would still operate, but would not receive critical payments from those insurance programs. If Mission loses its Medicare and Medicaid payments, that would likely close the hospital to most of its current patient population. That would be a disaster. Obviously, I'm not going to read all of it. And then here's what their 6. This is why I know they're either targeting them or they're starting with them. They'll do this everywhere, though. But it's because of what they list here as the reason. So the letter that indicates the deficiencies emanate from a survey conducted by the NCDHHS December 9th. Mission is not in compliance with the federal requirements in the following areas: governing body, patient rights, quality assessment and performance improvement program, nursing services, laboratory services, emergency services. If Mission does not remove the immediate Jeopardy condition, the federal government will send notice at least 15 days before it terminates its contract. So elected officials got up there and gave their speeches and all that stuff, how we have to do something, but this is all part of the globalist dream. Yeah, this was 2018 when hospitals merged. There's more and more now coming out about how this is so bad. I'm going to do another video about Steward Hospital. That's another one that's under fire, but that goes way more into detail about private equity firms running the hospitals. But ultimately, it's like you have to see that it's part of a bigger agenda. So you can blame the private equity firms as much as you want. They shouldn't be running the hospital, but neither should the CEOs. There's a reason at the big hospitals they move them in and out, because they hide them. Because they know they're not doing any good. They know they're not doing anything for patient care. They know they're doing everything the opposite. But you don't see the federal government. The federal government should be going after every hospital in this country because of staffing issues alone, but they should have been a long time ago. You don't provide enough staff, then all that stuff I just listed doesn't really matter, does it? Because that stuff will fall through the cracks. You're forcing people into positions where it's impossible for them to do their jobs in the most safe way. That's why they move these CEOs out. That's why your CEOs go into hiding or move out of the state where their hospitals are. They know they're not doing any good. When is any nurse in this country, last time you seen your CEO? Yeah. So I don't think anybody really has anymore, because they know they've been up to no good, and they know they've been colluding with the government and our professional associations in nursing and healthcare, all to bring in their socialist nightmare for the entire country.